As some people get older, the valves of their heart can get narrower. It's called aortic valve stenosis, and sometimes treatment includes intense open heart surgery. But new research shows many heart patients might have an option to avoid a major operation, especially younger ones who are just starting to feel the effects of age.
Researchers are putting a new spotlight on transcatheter aortic valve replacement, or TAVR for short.
Tavr is a minimally invasive surgery where doctors wedge a replacement valve in place of an old damaged valve instead of removing it.
It's been around for almost close to a decade, but it's really starting to take off over the past couple of years. And there's many programs throughout the country, including ours, that have been doing it for now several years with pretty good results.
In Tavr, a surgeon feeds a catheter and the valve up through a patient's groin. That's much easier on the body than open heart surgery, where doctors have to crack open a patient's ribs to access the heart.
Okay, so this is a successful deployment.
Dr. Michael Furstenberg and his team have performed more than 200 TAVR procedures since 2015. Until this recent research was released, the devices were usually only considered for patients who had a high risk of dying due to surgery because of their age, health, or other complicating factors.
One is their frailty, meaning how easy it is for them to get up and move around. Obviously, somebody that walks and plays golf and carries their clubs is a little bit different than somebody that is bedridden because of their medical problems. People that have had previous open heart surgery, for example, would be at increased risk for having problems if they needed repeat surgery. And then we factor in all of the other medical problems as well as the age of the patient.
Now, findings from 2 clinical trials show younger or lower risk patients who previously wouldn't have been eligible could actually be good candidates for TAVR. Compared to traditional open heart surgery, the less invasive procedure lowered their risk of death, debilitating stroke, and repeat hospital visits. Doctors estimate it could help as many as 20,000 more people every year.
At 30 days, TAVR had a better safety profile with less disabling stroke or mortality, less stroke, less atrial fibrillation, less kidney injury. And by the way, you got out of the hospital in half the time of surgery.
We should note something here, though. The trials were sponsored by the makers of TAVR valves, which is fairly common practice in the medical device industry. Dr. Furstenberg doesn't think it's a deal breaker.
When you have some of these clinical trials that the data is run by the manufacturer, does that create a tricky situation?
Oh, clearly, and it's a delicate situation because for the most part, the industry needs to fund and support the trials to get the approval by the FDA. But it's also important when you look at these things, yes, there is sort of a conclusion that fits nice on a tweet, but it's important to really look at the data, how the trial was done, what the patient population was, and what the nuances are to help then determine whether that's the best thing for you.
The FDA is expected to approve the device for less risky patients, something that Dr. Furstenberg says could be a game changer. Without FDA approval, insurance doesn't cover the procedure, and he says the valve alone can cost up to $35,000.